Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Today's presentation is about Bell's palsy. We will cover successively Bell's palsy, Bell's phenomenon, the diagnosis, bilateral palsy, Guillain-Barré syndrome, Lyme disease, and Mobius syndrome. There are 4 levels of lesion during the paralysis of fascial nerve. The first one is before the geniculate ganglion. The alteration lead to deficit in tears, lacrimation. The second level of lesion is about the stapedius reflex, which is lost. The second level of lesion is about the two-third anterior tongue with the loss of taste. And the fourth level of lesion is the foramina with loss of facial expression, temporal, zygomatic, buccal, mandibular, and cervical branch of the facial expression. In Bell's palsy, herpes simplex virus immune system reaction within facial nerve in facial canal. This causes mild inflammation, which compress blood supply of the nerve. There is a failure of nerve conduction, and the problems are reversible. If severe and prolonged, it leads to degeneration with pain behind the ear near the stylomastoid foramen, and then facial weakness starts. Brachiomotor lesion lead to hyperacusis with no control for the stapedius muscle. The deficit in muscle supply in the face and the failure to produce a wrinkle of forehead. What is Bell's phenomenon? It's upward and outward movement of the eye. Lower eye yield drops. Eye cannot be completely closed. Dry eye may occur. Nasal labial folder lost ipsilaterally. Lower eye yield ectropion. In patient unable to show. There is also an hemifacial movement are uncovered. Inability to smile, to pull to healthy side, inability to put off cheeks, inability to wrinkle, and inability to close the eye. Bell's phenomenon, upward and outward movement of the eye. Lower eye drops, eye cannot be completely closed. Dry eye, nasal labial folder lost, ipsilaterally, and lower eye ectropion. Patient unable to show, inability to smile, inability to puff cheeks, inability to wrinkle, inability to close eye. Two-third anterior tongue will lose gustative sensation ipsilaterally. Most of patients recover during few weeks. Keep the patient under steroid prednisone to reduce inflammation and cover A with dark glass. Long-run evolution lateral tarso raphy. Diagnostic. All causes are ruled out. Diagnostic by elimination. CT scan for schwannoma. Lacrimation is lost before rediculate. 15% of patients do not recover because degeneration and lead to plastic surgery. Bilateral lesion could be congenital, could be sarcoidosis, could be Lyme disease or Guillain-Barré syndrome. Guillain-Barré syndrome began in lower extremities and ascend bilaterally. Weakness with ataxia progressing with symmetrical paralysis. Minimal muscle atrophy progress over hour to day. Problem cause respiratory, talking, swallowing, bowel and bladder function. Sometimes it need assisted ventilation in emergency. Lyme disease, the pus pernio, A itching and burning, and tearing on large lymph node, heart problem, and brain complication. Lyme disease alert. Do a thorough body check for ticks after being outdoor. How to remove a tick using tweezer, grasp tick near the mouth part, as close to skin as possible. Pull tick in a steady upward motion away from skin. Do not use kerosene, match, or petroleum. Disinfect seat with soap and water. Record date and location of tick bite. We smile with our heart. Mobius syndrome. It's a rare congenital neurologic disorder. Complete facial paralysis. Cannot close the eyes. Corneal reflex is lost. Unable to form facial expression. I have limb and chest wall abnormality, but normal intelligence. Facial expression is incorrectly taken to be due to dullness. Incompletely closed yield, facial paralysis, inability to move A, crossed A, small chin and mouth, cleft palate. Thank you for watching this episode of Medicine in 3 Minutes. Make sure to click the like button and subscribe. Your comments are very welcome. Thank you.